Wound care management is a holistic process of building a host defense mechanism against invading microorganisms. When we are managing wounds, what we are trying to do is to assist an individual fight off infection. As you know, infection is inhibition by proliferating microorganisms in a level that invokes either systemic or a local response in the host. We have diabetic wounds, we have managed malignant wounds, we have managed pressure injuries, we have managed post-operative wounds, both in acute and chronic stage. We have also managed skin tears, burn injuries. We have covered quite vast area in wound management in this area. Invasion by microorganisms is what usually causes wound infections. You know, the skin being our biggest organ in the body that acts as a cover. Once the skin is broken, that is when you have opportunistic infections or invasion by these microbes, and then you end up with what we call infection. We are able to determine whether wound is doing well or not based on how the wound is behaving. Because every time you manage a wound has possibility to be spoiled to whatever you're giving it. And you are able to determine that by actually looking at the wound itself, the tissues, look at the edges, look at the amount of exudate coming out from the wound. You look at the wound bed, what you're dealing with, look at whether there are any signs of infection or whether infection has reduced. So all those factors play in being able to determine whether the wound is progressing, whether you are achieving healing, or possibly whether the wound is deteriorating or becoming worse. For a post-operative patient to recover, there are several factors that play in there. One is the premorbid history of the patient, the cause of the wound or the etiology of the wound, how did it take place. Another issue is the patient himself, the hemodynamic status of the patient, the nutritional status of the patient, the age of the patient. All those factors play in there. A stoma is a Greek word for a mouth. It means an opening into. So a stoma can be created anywhere in the body, in the gut, right from the esophagus up to the small and the large bowel. Now, stomach care is basically care given to an individual before and after fashioning of a stoma. And that also involves the follow-up part of the care.
We serve our patients either from wards, discharge, casualty, or other hospitals if they come necessary for us. Mostly we deal with surgical patients, apart from the liver clinic, which is manned by the medical team of this physician, and the renal clinic, which is normally run by this group of renal physicians. SOPC initially was not really taking much care as far as the wounds management was concerned, because we just used to do the minor dressings. Of late, we got the specialized nurses. Well, they are dealing with the stomas, they are dealing with the backs, compressions, and now the outpatient and dressing room deals with the general management of the small ones, which does not require any specialized care. We have the adults, which normally we have the general surgical, we have urologic, we have the neuro, we have the plastics, and also we have the general surgery. For pediatrics, we normally have plastics and neurosurgery. So those are the categories of patients. SOPC is offering a very good service, and this service is newly introduced and very few people know about it. And those who are from other hospitals, if they require any specialized care as far as Stoma is concerned, we have a very good trained team, highly trained and very specialized, and they really have the skills. And Kenyatta is also supporting them.